The world has been looking for a malaria vaccine to be used in Africa for over 100 years now. Malaria being potentially the largest killer of humans on this planet over history, remains a major cause of disease and death in Africa. The announcement that we have a first-generation vaccine with moderate efficacy, but that can save hundreds of thousands of lives when deployed together with the other interventions we have, is a scientific breakthrough. It's a public health historical event that for the first time, a malaria vaccine can be safely and efficaciously deployed to save lives of African children.
You said African children. Are they mostly the victims of malaria?
The brunt of the disease is carried by Africa, and within Africa, it's young African children and pregnant women, but mostly young African children, the ones that suffer the most severe consequences of the disease and die.
The world has been focused on a pandemic. How much of an impact has that had on the research and development of this vaccine?
Altogether, probably less than $1 billion have been invested in this and any other malaria vaccine over the last 30 years. Just imagine the comparison of what the world has invested in COVID vaccines over the last 12 months. I think it sends a very powerful message both to other vaccine developers, but to the broader international community, particularly in this post-COVID-19 era, where we cannot leave anyone behind. We should not be leaving anyone behind. And most importantly, we should not be leaving African children deprived of the powers of science and technology, developing effective vaccines that can provide them an outlook of a safe future ahead of them. I think we are at a turning point.
You are dealing with a parasite. That's what made it more difficult than trying to evolve, for example, a COVID vaccine.
This is orders of magnitude more complex than a COVID vaccine or any of the other vaccines we have today. It is really comparing a bicycle with the space shuttle. The orders of complexity are in those scales. And the world had never had a vaccine against a human parasite, not just against malaria, against any human parasite.
What impact will this vaccine rollout have on Africa?
Together with other interventions, a malaria vaccine will help us save tens of thousands of lives, hundreds of thousands of lives, prevent millions of cases, and help us regain momentum in the fight against malaria. It is of massive global significance.